If you are over 70, stop your next appointment. Today, we expose the 5 most dangerous health checkups that are pushing millions of seniors closer to unnecessary surgery, stroke, and new cancer. We are starting with why the bone density scan is destroying quality of life. Number 5. Bone density scan. This test, the DEXA scan, sounds harmless, but after 70, the results almost always show low density. This is natural aging, like gray hair. The problem is that doctors panic, pushing seniors onto drugs like bisphosphonates. Studies show these drugs reduce fracture risk by only 0.3% after 5 years, a massive risk for almost no reward. Take Jenny, a 76-year-old piano teacher. No falls, no pain. The scan showed mild loss. Her doctor gave her the drug. 3 months later, she couldn't play piano due to severe reflux and jaw pain. We stopped the meds, focused on vitamin D and resistance training. A year later, stronger legs and 0 fractures. Lifestyle changes reduced fractures by over 20%. Don't let a number scare you into treatment you don't need. But if you think a little jaw pain is bad, brace yourself. The next checkup on this list, number 4, is a scan that can lead you directly to brain surgery. Number 4, brain MRI for memory loss. When seniors forget keys, doctors order an MRI. The uncomfortable truth is that 97% of these scans are useless. They show normal age-related shrinkage, but once those normal spots are seen, they trigger a cascade of fear, invasive tests like spinal taps, and even exploratory biopsies. Consider Adam, 74, misplaced keys. MRI showed normal white matter change. He panicked, convinced he had dementia, and stopped driving. His anxiety became the real illness. We fixed it with a simple cognitive test, hydration, and brain games. Unless there are severe symptoms, an MRI is rarely helpful. A better first step is a cognitive screening test. It's cheap, effective, and avoids the panic. Avoiding unnecessary brain scans saves your mental health. But can you imagine a test where the false alarm rate is 40%? Brace yourself. The next test, number 3, is one you've probably had multiple times, and it leads straight to unnecessary heart surgery. Number 3, cardiac stress test. Used for mild fatigue, this test often leads to false alarms. The false positive rate for seniors over 70 can be as high as 40%. That false positive leads to procedures like angiograms and unnecessary stent placement. More than half of all stents placed after stress test referrals were done in patients with no real benefit. Ragnar, 75, just felt tired on hills. Stress test was unclear. He was sent for a catheterization, a stent was placed, and that night he developed kidney problems from the contrast dye. The fatigue never changed. If you lack classic cardiac symptoms, a better option is a coronary calcium scan. It's safer, simpler, and less likely to push you into a needless procedure. Protecting your heart is vital, but the next test, number 2, is a universal screening tool, and the preparation alone can cause kidney failure. Number 2, colonoscopy. Past age 70, the risks skyrocket. The prep is harsh, strong laxatives cause dehydration, dizziness, and kidney issues. The sedation risks brain function. For every 1,000 colonoscopies over age 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Laura, 73, had no symptoms. New doctor urged the test. During the procedure, a polyp was removed and she went home. That night, bowel perforation. 9 days in recovery, all for a test she didn't need. The safer option is often the FIT test, fecal test. No prep, no sedation, and still catches most concerns. We have cleared the dangerous list, but now we come to the most overused, most dangerous checkup of all time, number 1. It is the test responsible for causing cancer. Number 1, annual full-body CT scans. Marketed as elite screening, These scans expose your body to massive doses of ionizing radiation. Each scan delivers the equivalent of 500 chest X-rays. The rise in CT scans may now be responsible for up to 5% of all cancers in the US. Marcus, an active 80-year-old, felt great. Elite Tech-Up. Scan showed a tiny, harmless nodule. It set off a chain reaction, a PET scan, a needle biopsy. The result was benign, but the biopsy collapsed part of his lung, leading to a 2-month recovery. Experts advise these are never used for general screening. Your health is too valuable to waste on fear-driven screening that could leave you worse off. Modern medicine is powerful, but it's not perfect. Sometimes less is more. Always ask, what happens next if this test finds something? Now, we want to hear from you. Have you faced complications from a test that turned out to be unnecessary? Share your experience in the comments below. Like this video to help other seniors see this truth. I'm the doctor, and remember, real prevention starts with lifestyle.